I would say that the difference between neglect and abuse is a willfulness, right? And so an abuse is something that they're doing willfully or intentionally. They're unreasonably confining a resident, whether that's through physical restraints or whether through its chemical restraints, where they're over medicating a patient so that they don't want to move around and get out of bed. That's abusive. It could be sexual abuse, where they're sexually exploiting someone, physically abusing someone, hitting, things of that nature, emotional or verbal abuse towards residents in the way that they speak to residents. Those are abusive types things. Neglect is where they're not getting the services that they need, that the patient needs. Maybe they're not being turned to reposition in the way that they need. Maybe they're a fall risk and they're not properly assessing that fall risk or doing things to prevent falls. Maybe the patient needs to be gotten up and walked around so that their legs don't contract. Things like that, where they're not getting the services that they need. Now, what is the difference for our cases? It's just a matter of proving up what the conduct is, because ultimately they're both violation of the residents' rights, and they are both things that the facility needs to be accountable for. What that accountability looks like will be determined by the jury. And if the jury thinks that it's abuse or neglect, that may factor into how the jury determines what level of accountability is appropriate. But we just prove up the conduct. It's what our job is.